When Pakistan's army launched an offensive in her village, Bak Begum was 8 months pregnant and very vulnerable. There were only minutes to get out before the shelling started. Bak and her family walked for a whole day before getting an expensive ride to Swabi. They charged us 4,000 rupees for the journey. I had to sell them my jewelry. The family ended up at a new tent camp. Yar Hussein is home to 10,000 war refugees, a small fraction of the 2 million who fled the Swat Valley in May and June. 90% of the displaced live with host families or in unmanaged settlements. A health clinic was near Bak's tent. She went to ask for a bed. The staff gave her a prenatal exam, her first ever. They urged her to return to give birth when the time comes in their clean delivery room. Bak was not sure what she would do. My mother-in-law helped deliver all 3 of my children at home. My husband can help this time. He takes good care of me. 70,000 of Pakistan's new refugees are pregnant. Every day, more than 250 give birth. As many as 40 face potentially life-threatening complications. The risk is compounded by the hardships of flight and camp living, and by conservative traditions that restrict women to their homes. But mothers' survival odds have improved at 6 refugee camps, where a Pakistani medical team has set up well-equipped maternity clinics with the support of international organizations. Female doctors and midwives offer patients pre- and post-birth care. They live at the clinic and are ready to perform deliveries at any hour. Women ask me to persuade their husbands to let them leave their tents to deliver at the clinic. Lives are being saved. 19-year-old Taj Bibi was in labor in her tent for 2 days before a social worker found her. She came to the clinic in the nick of time. She was anemic and dehydrated. She fainted every time she had a contraction. We feared she would not survive a trip to the hospital, so we made her feel comfortable and delivered the baby here. Risky cases are normally referred to local hospitals. International organizations are helping to upgrade their delivery rooms to handle the extra volume. There are 67 pregnant women living in the Palosa camp in Charshada. Dr. Bushra Rubab gives them basic health information along with care.
We are counseling them, we are educating them that next time, not only here, but anywhere when you again become pregnant, you should consult the doctor.
Managing Pakistan's crisis is hazardous. On June 9th, a bomb killed several humanitarian workers, including 3 from the clinic's support team. The medical services continued without interruption. Thanks to these clinics and their dedicated staff, pregnant women like Bak Begum have something they never had before: the chance to give birth in a sanitary place, assisted by a skilled health worker. William A. Ryan and Mark Westhoff prepared this report for UN Television and CNN World Report.